internal medicine. All right. Now, a middle-aged woman who is a known hypertensive with a history of non-compliance to medication presented with shortness of breath, which got worse on lying flat. So autopnea. She added that she gets tired easily with a productive cough of pinkish, frosty sputum. Pinkish, frosty sputum. BP on presentation is 220, 130. And sometimes you see this pinkish sort of sputum when the heart is more of edematic, or when there's a lot of fluid, or when there's pulmonary edema. You usually the patient end up coughing this kind of a sputum, or this characteristic kind of sputum. Yeah. So basically, that's what comes to mind. So here you might be looking at something related to what? To the heart pathology, to the lungs pathology, and so on and so forth. Okay. So, and then you ask yourself, so what can cause pulmonary edema when it's a problem with the heart, isn't it? And again, they've told you that this person is hypertensive. So, like I've been saying, if they give you a question and they tell you the anamnesis, or they tell you a diagnosis that, or a chronic illness with this person, start looking out for what? The complication or the possible complications this might lead to. And to top it off, or to top it up, this person is even non-compliant to medication. So definitely, whatever that is happening here, it is the result of uncontrolled hypertension. Uncontrolled hypertension. All right. So guys, let's move on. What is the likely diagnosis? What is the likely diagnosis? So over here, you can look at for what? Acute left ventricular failure, secondary to severe uncontrolled hypertension. I repeat, acute left ventricular failure, secondary to severe uncontrolled hypertension. Yes, uncontrolled hypertension. Because now look at the presenting BP, 230, 130. This is extremely high. This is extremely high. And again, I was talking about the productive cough of this nature. Now, if the left heart is failing or has failed, what it means is that the blood inside the lungs are not going into the left side of the heart for it to be pumped out of the body. So everything is congested because the left heart, which is supposed to pump, has failed or is failing. So as a result, everything starts accumulating congestion inside the lungs. And that is the reason why we are saying that the likely diagnosis here will be the acute left ventricular failure, secondary to uncontrolled hypertension. Uncontrolled hypertension. All right. What are the signs? What are the signs of this condition? Signs of this condition. So you have left, not you. I mean, your client is having acute left ventricular failure. What are the signs that you can be looking at for? So one of the signs include tachypnea. Tachypnea, that is what trying to hyperventilate, trying to breathe, isn't it? So you end up having what? Tachypnea. Then you can talk of what? Tachycardia. Tachycardia. Basal crepitation. Gallop rhythm. Displaced apex beat. Displaced apex beat. You can find cardiac murmur or third sound. Third sound. Cyanosis. Cyanosis. Rhonchi. Rhonchi. So these are the signs. You can just mention any one of them. Again, tachypnea, tachycardia, basal crepitation, gallop rhythm, displaced apex beat, cardiac murmur or the third sound, cyanosis, rhonchi. Rhonchi. You can add a whole lot to this, and you will be absolutely correct. All right. 4 risk factors of the condition. risk factors of the condition. Yes, I know many people love to differentiate between modifiable risk factors and non-modifiable risk factors. When we say modifiable risk factors, they are things that you can actually change. The non-modifiable, they are things you cannot change. Just like when you are born with it. You are born with it, you can't change it. Your race, you can't change it. That is who you are. Your gender, that is who you are. You can't change your gender, isn't it? So these are some of the what the non-modifiable risk factors. We now have what the modifiable risk factors, such as obesity, the diabetes, the alcohol abuse, the high blood pressure, coronary artery diseases, myocardial infarctions, valvular heart defect, congenital heart defect. Now, congenital heart defect, valvular heart defect, these are something that are what you are born with, isn't it? But still, we can find a way around them. Okay. So this one I'm just mentioning generally. So whether it's modifiable or non modifiable is general because the question is also general. Okay. Question not specific on whether it is modifiable or non-modifiable. It just said give the risk factors. So we can give as many as we want. So keep writing them. Even medications such as NSAIDs can even be a risk factor for development of acute left ventricular failure. So again, high blood pressure, coronary artery disease, myocardial infarction, diabetes, obesity, alcohol abuse, congenital heart defect, valvular heart disease, certain medications like NSAIDs. You can be thinking about the gender, you can be thinking about the race, and so on and so forth. There are a lot. Just mention 4 and you are good to go. Now, list 3 diagnostic investigations you will do. So someone is having what? Acute left ventricular failure. What are some of the investigations you would like to do? Definitely, you would like to assess the heart, isn't it? So you do a chest X-ray. You do your ECG. You do the ECG to know the electrical activity of the heart. Then, one of the most important ones, echocardiogram. You need to do echocardiogram because that reveals the functionality of the valves. If the valves are in right standing, if they are good, or they're having problems. So you do your echocardiogram. All right. 4 supportive investigations. That means what other thing can support what you are thinking about. So of course, you can do your full blood count, your liver profile, your BU creatinine, your urinary, then the fasting blood sugar. So these are all what supportive. So basically, it helps us to identify the risk factors that we are having. For example, if someone is obese, definitely when you do a lipid profile, you might see high cholesterol level or a lot of what triglycerides. All of these things are all what supportive investigations. All right. How will you manage this patient? How are you going to manage this patient? Yes, of course, even though this person didn't come in the emergency room, but this question demands something like that because it's an emergency. It is an emergency case because you are having what? Difficulty to breathe. And when you lie down, there is a problem with breathing. That's autopnea. There's a problem with breathing. So we might want to consider it as a factor in our management. So what are you going to manage this person or how are you going to manage this person? So basically, you have to prop up the patient in a cardiac position, first of all. Prop up the patient in a cardiac position. Because when the person lies down flat, trust me, he can't breathe. He cannot breathe. So you have to put the person in a cardiac position. That's more or less like about 30 degrees from, the head area should be placed about 30 degrees from the surface or the flat surface. 30 degrees. Okay. Then, of course, you have to give intranasal oxygen. You have to give your intranasal oxygen. Then you have to give, now you want to reduce the BP. So you give what? Diuretics. You can give your diuretics. diuretics. So all of these things is to control what? The BP. So you can give your diuretics, you can give your ACE inhibitors, you can give your beta blockers. All the kind of medications are used to control the BP. Then you might want to also manage other risk factors. You might want to manage other risk factors like the diabetes, like the dyslipidemia, and so on and so forth. Now, long-term prevention or long-term management, that is non-pharmacological means. What you want to do is you want to tell the person or advise the person on their lifestyle. So definitely lifestyle changes. So if the person is a smoker, you ask the person to quit or to stop smoking, to reduce the alcohol intake, to exercise regularly, to have a very good diet therapy, and there should be periodic follow up to see how the person is adjusting to medication and how the person is responding as well to the medication. So again, these are the summary of your management. Prop the patient up in cardiac position, give intranasal oxygen, give your diuretics, control the BP, then manage other risk factors such as the diabetes and so on. Then encourage the person to stop smoking, reduce alcohol intake, regular exercise, and diet therapy. So these are your management for this patient. All right.